5 things you absolutely need to know about the morning after pill. Adverse effects, risk of sterility, delays in us. Many rumors circulate about the morning after pill. We take stock of the true from the false. Condom cracking, unprotected or forced sex, forgotten pill. Each year in France, approximately 1 in 10 women under 30 uses emergency contraception to avoid the risk of unwanted pregnancy. Many rumors circulate about the misnamed morning after pill, as recently shown by a study by Public Health Frank. Thus, 1 out of 2 women questioned considers that she is dangerous or that she can make you sterile. A phenomenon illustrated in a survey published on July 31 by the Daily Liberatio. Among these misconceptions, there is also an exaggeration of side effects and poor knowledge of the time limits for us. Le Figaro takes stock. 1. It's not an abortio. Unlike abortive drugs, which aim to terminate an ongoing pregnancy, emergency contraception aims to prevent the fertilization of the egg by a spur. In France, there are 2 types of morning after pill, Norlevo and Elan. Over the counter in pharmacies, they are only reimbursed for adults if they have been prescribed by a health professional but are free for minor. Each contains a hormone. The first is levonorgestrel. The second, Elan, has ulipristal acetate as its active ingredient. By blocking the growth of the ovarian follicle, egg forming in the ovary, both are able to delay the time of ovulation. Thus, the spermatozoa waiting in the fallopian tubes do not encounter any egg to fertilize. These pills are ineffective once the fertilized egg has implanted itself in the uterus and implantation has begun. They can only act upstream of a pregnancy. As such, they are not abortive drug. On the other hand, Elan could decrease the chances of implantation of the egg in the uterus. 2. The morning after pill can be taken up to 3 or 5 days after unprotected say. Contrary to what its name suggests, the morning after pill can be taken beyond 24 hours after unprotected intercourse. Depending on the type of pills, the delay is different, up to 3 days for Norlevo and 5 days for Elan. However, it is preferable to take it as soon as possible because it is all the more effective. 3. The morning after pill does not make you sterile. Like the classic pill, emergency contraception has no negative impact on fertility, nor does it increase the risk of having a spontaneous miscarriage or an ectopic pregnancy in the future. 4. Taking it too often is not bad for your health. Emergency contraception can be used as many times as necessary to avoid an unwanted pregnancy, without causing any problem. Adverse effects can occur, but they are rare, moderate and usually disappear within 24 hours. These may be menstrual disorders, early or late menstruation, repeated small bleeding, heavy menstruation, nausea. Between 25% and 50% of women suffer from it. Headaches, 1 in 6, lower abdominal pain, fatigue or tension in the breast. Furthermore, emergency contraception does not increase the risk of venous thrombosis, phlebitis, pulmonary embolism, as is the case with estrogen-progestogen pills, in particular those of the 3rd and 4th generation. Indeed, the morning after pills do not contain estrogen, a hormone which can modify certain parameters of blood coagulation. According to the criteria established by the World Health Organization, WHO, there is no situation in which the risks of using emergency contraception are greater than its benefits. Thus, women with a history of ectopic pregnancy, cardiovascular disease, migraines, liver disease or breastfeeding can take the morning after pill. 5. Morning after pills are not 100% effective. Emergency contraception is never 100% effective, even if taken very soon after unprotected intercourse. Norvelo is 98% effective when taken within 12 hours of intercourse. For Elan, this rate is 85% when taken within 3 days. For both, the effectiveness decreases over time. Thus, it rises to 58% for Norvelo when taken between the 2nd and the 3rd day following intercourse, and to 61% for Elan between 2 and 5 days late. Note that until the next period, It is important to use a condom because emergency contraception does not protect against the risk of pregnancy until the end of the cycle. If emergency contraception follows a forgotten pill, the latter must be continued until the end of the pack, but it may have reduced effectiveness. Again, it is better to use condom. Given the relative reliability of emergency contraception, a pregnancy test 3 weeks after the date of unprotected intercourse is recommended. It should also be remembered that emergency contraception helps out but does not replace regular contraceptio, and above all, it does not protect against sexually transmitted infection. There is another method of emergency contraception, copper intrauterine devices, IUDs, which are 99% effective when inserted within 5 days of intercourse. Their installation requires a consultation with a gynecologist, a general practitioner or a midwife.